Out there in practice, you'll see a variety of activities in the area of healthcare quality measurement and improvement. Let's look at some of these activities overall. The first area to look at is quality measurement. There are numerous efforts around to develop and implement quality measures. Doing a good job of this can take some real effort and involve multiple aspects. One aspect is finding the right set of measures to use. Structure, process, and outcomes can all be useful in different circumstances, and often they're useful in combinations. For example, outcomes are often the most interesting, but are harder to track than processes, so you'll find measure sets that include some of both, taking advantage of their strengths. You'll find measurement activities that involve broad sets of measures designed as a big set, and you'll also find narrower efforts that focus on particular areas or particular measures. And there's a lot of effort to develop new measurement approaches and expand the quality measurement toolbox. Measurement activities are being developed and implemented by a variety of different entities. Some measurement activities are undertaken by organizations working to improve quality. For example, in the U.S., the National Center for Quality Assurance has developed a system of quality measurement for health plans called the Healthcare Effectiveness Data and Information Set, or HEDIS, that includes a range of measures, structure, process, and outcome, that can be used to compare health plans. It's gotten a lot of use and is pretty widely known. It incorporates a range of measures that have come to be used in a variety of settings now. Government organizations may be involved in quality measurement too. In the U.S., for example, the Medicare program has developed tools for measuring the quality of healthcare providers. And of course, providers themselves are often measuring their own quality and assessing their own performance. Sometimes individual hospitals or doctor practices will implement quality measures on their own. And as another example, physician specialty societies, larger organizations of physicians, may keep registries of patients or do other measurement to help their members track quality. So there are lots of quality measurement activities out there done by a variety of entities implementing a variety of measures. What then should we do with all the quality data being collected? There are several different things being done. The first area is maybe the most straightforward. Sometimes the data are just used by providers themselves to monitor their activities and look for opportunities to improve. Or, related, sometimes the data are being used by others, like health plans or government regulators, to look for variations and patterns that might suggest opportunities for policies or other interventions to improve quality. A second common area is public reporting. This includes efforts to collect information about provider or plan quality and release it to the public in the hopes that this might spur quality improvements and also might help patients when they're choosing providers to use. A third use is in the design of payment incentives. There are active efforts to link payments to providers to their quality scores, for example, paying providers more when they get better scores. We often refer to this as pay for performance. And there are many versions of pay for performance in various stages of development and use out there. Internal review of the data, public reporting, pay for performance, and related things can all help point out opportunities for and incentivize providers and others working on improving quality. In the area of efforts to improve quality, then, you'll also find many, many different things going on. Really, and kind of unfortunately, it's too many for us to go over in a reasonable amount of time, so you'll have to investigate some of these areas of your specific interest on your own. But there are things like, are there better ways to generate diagnoses? Are there better ways for provider teams to work together? Are there better ways to get patients to the right providers in a timely way? Better ways for leaders of organizations to learn about and manage their organizations for quality? Better ways to use electronic records and computer systems to help providers? And on and on. There are lots of interesting things that can be pointed out by our measurement activities. They're changing all the time and they're offering new opportunities. Measuring quality and using measures to try and drive improvement is a really important area in the healthcare system with many different aspects to keep your eye on, lots of activity, and lots of opportunities for further investigation and innovation.